Hi everyone, I'm so sad I couldn't be with you in Lyon. I was really looking forward to it, but I've had a nasty injury which required surgery, believe it or not, to my knee. Now I use tenodesis very frequently, and the summary is I use it whenever I'm worried. This slide shows all the reasons I would want to use it and I would advocate for it. But basically, if there's any case that's more difficult than average, I would want to use it. I make an incision on the lateral side of the knee towards Gerdy's tubercle. My index finger is pointing where my thumb is now, and it goes over the lateral epicondyle of the femur. I deepen it through the fat down to the IT band, and I make two parallel incisions either side of the Gerdy's tubercle, which is where the retractor is, and the retractor is the appropriate width by lucky coincidence. And you can see that there. I then need to choose the length of graft, and to do that I need to palpate the LCL and the epicondyle through the wound, and then I will take 2 to 3 centimeters proximal to create a graft that's left attached distally to Gerdy's tubercle, and I amputate the graft as you can see here. Next, I'm going to take that graft deep to the LCL, so I take the soft tissue off the LCL and make a small incision with a knife at the anterior edge of the LCL, and through that I'm going to place some scissors to create a tunnel, as you can see here. In our experiments in the laboratory, it's essential to take the graft deep to the LCL as it creates a much more isometric behavior. It must not be placed superficial to the LCL. Lemaire's point, where I'm going to attach the graft in this case, is 1 centimeter proximal and 0.5 centimeter posterior to the LCL attachment to the femur. And I create a bleeding bony bed with a periosteal elevator, as you can see. Now you can attach the graft safely at points 3, 4, and 5, 5 being Mackintosh's position, 3 the modified Lemaire position. And we've shown that again in the laboratory. I'm placing my suture anchor here at Lemaire's point, 10 millimeters proximal, 5 millimeters posterior to the LCL attachment to the femur. Next, I'm going to take the graft deep to the LCL, and then I'll want to attach it to this point. It's very important that you have the knee in neutral rotation, that is 10 degrees of external rotation, the comfortable position we walk out, the progression ankle, and you do not pull too hard on the graft. It needs to be just 20 newtons or less, so you take the slack out of the graft. It's a bit like an MPFL reconstruction, because you don't want to create a fixed external rotational contracture, as that would be bad for joint surface contact pressures. So the flexion angle of the knee is much less important. We've tested 0, 30, and 60 degrees, and they all work well. So with the knee in the right position, just with the slack taken out, I suture down the graft using 2 number 2 sutures, and I have enough graft proximal that I can fold back over itself over the LCL, and I suture it down with some heavy absorbable sutures, as you can see here. The fixation points I've already mentioned, but with children, I think it's good not to fix proximal to the growth plate. Otherwise, you might create a tether that would constrain the growth plate and affect growth. And so you can see we can easily fix the graft with a suture anchor distal to the growth plate. Frequently, though, I do use staples, but if I use staples, they need to be more proximal in the Mackintosh position, so they're well clear of the femoral end of the graft and its fixation, and that they're not too prominent. Finally, the question of whether or not you close the tenodesis harvest site arises, and it doesn't matter biomechanically, but if you've got muscle exposed, then you do need to close it. But the reality is I will close it just distal to the LCL and I leave it open. Does it work? It certainly does. We published a large series of professional athletes. There was an overall nearly 8% graft rupture rate. With a tenodesis, it was 9.5%, and without was only 3.4%. And that was statistically significantly different. And these are my disclosures. Thank you so much for your attention.